Welcome to this presentation on foods to avoid with dysphagia. Whether you're a caregiver, health professional, or someone living with dysphagia, this guide will help you understand which foods may pose a risk and why. Eating should be both safe and enjoyable, and we're here to make that possible. Dysphagia is more than just a nuisance, it's a serious medical condition. It occurs when swallowing becomes difficult, which can lead to health risks such as choking, lung infections from food entering the airway, and nutritional deficiencies. Understanding dysphagia is the first step toward safe eating practices. Certain textures and consistencies can make it hard for those with dysphagia to swallow safely. These foods may stick to the throat, fall apart in the mouth, or go down the wrong way. By identifying and avoiding high-risk foods, we reduce the chance of choking or aspiration and promote better nutrition. Fibrous and tough foods require a lot of chewing and effort to break down. For someone with dysphagia, this can be exhausting or even dangerous. Foods like celery and steak can stay in large, unmanageable pieces and increase the risk of choking. Crispy foods may seem light and airy, but they can shatter into sharp fragments that are tough to control while swallowing. These pieces can scratch the throat or even be inhaled into the airway, posing a significant risk. Examples include toast, fried chicken, potato chips, and bacon. Sticky and chewy foods cling to surfaces in the mouth and throat. This can make them difficult to move or swallow effectively. They often leave residue, increasing the chance of choking or aspiration. Hard and dry foods don't break down easily without plenty of chewing and saliva. For people with dysphagia, these foods can feel like dry lumps in the mouth and throat, making them unsafe to swallow. Crunchy foods break apart unpredictably in the mouth, creating uneven and jagged pieces that are hard to control. This can lead to food particles being accidentally inhaled, which is especially dangerous for individuals with dysphagia. Crumbly foods scatter into small, dry pieces that are hard to gather with the tongue or control while swallowing. These crumbs can easily be inhaled or stuck in the throat, increasing the risk of aspiration. Foods with sharp or spiky textures can damage delicate mouth and throat tissues. Even a small scratch can make swallowing more painful or dangerous for someone with dysphagia. Tiny seeds or pips might not seem threatening, but they can easily become lodged in the throat or be inhaled into the lungs. These small particles pose a high choking risk and should be avoided. Skins, bones, and gristle are tough, unpredictable, and dangerous for anyone with dysphagia. Even small pieces can cause choking or injury, so all food should be thoroughly checked and modified as needed. Sticky and gummy foods like peanut butter, sticky rice, marshmallows, and gummy vitamins can cling to the throat or roof of the mouth, making them difficult to swallow completely. They often require multiple swallows, increasing the likelihood of aspiration. The skins of fruits and vegetables may not break down easily and can peel off and stick to the throat, increasing the choking hazard. Peeling these foods beforehand or avoiding them altogether is often safest. Stringy textures can get caught in the throat or wrap around the tongue, making them tricky to control and dangerous to swallow. These should be replaced with smoother alternatives. Cooking these foods to a tender soften can make these foods safe. Hard raw foods need forceful chewing, which can be tiring or impossible for someone with dysphagia. Pieces can remain too large or sharp to swallow safely. Hard raw foods need forceful chewing, which can be tiring or impossible for someone with dysphagia. Pieces can remain too large or sharp to swallow safely. Hard crusts can be dry and crunchy, making them a poor match for someone with dysphagia. They often require a strong bite and good saliva production, which isn't always possible. Many fruit and vegetable peels are fibrous and hard to chew. If not removed, they can become a choking risk or get stuck during swallowing. Always peel these foods thoroughly or serve alternatives. Mixed textures, like solids and liquids, are tricky because they require the body to manage two different consistencies at once. This can confuse the swallowing reflex and lead to aspiration. Some juicy fruits and vegetables release thin liquid when bitten or chewed. This thin liquid can separate from the solid pieces and reach the throat too quickly, making it hard to control or coordinate the swallow. For people with dysphagia, this sudden release increases the risk of choking or aspiration, especially if they do not tolerate thin liquids. Thickening agents or choosing less juicy alternatives may help reduce these risks. By learning which foods are unsafe for those with dysphagia, we can help prevent serious complications. Remember to follow the specific texture guidelines recommended by healthcare professionals. With the right approach, mealtimes can remain safe, nutritious, and enjoyable. Thank you for your attention. If you have any questions or need help adapting meals for someone with dysphagia, please don't hesitate to ask. Together, we can support safe and satisfying eating experiences. Please note that this presentation is for educational use only. It does not replace the advice of a licensed healthcare professional. Each individual's needs are unique, so be sure to consult with a speech-language pathologist or dietitian to develop a safe eating plan tailored to their condition. Don't miss out. If you're enjoying the content, make sure to like the video, subscribe to the channel, and hit that notification bell so you never miss an upload. We've got more awesome content coming your way. Stay tuned.